Let's dive into the discussions shaping the nation.
Thank you, Ceann Comhairle, and I would like to thank the members of the House for their contributions this afternoon on behalf of myself and Minister Butler. I think it is clear that while we all recognise that there are areas of service improvements, the passion with which we have discussed the issues is a testament to the fact that mental health is an important topic across all parties and across all parts of government. Much has been said today in relation to ensuring that our mental health services are modern. It is important that our capital infrastructure, which by these services are delivered, keep pace and provide modern, accessible, safe environments for service users. To this end, the HSE are developing a 3-year prioritised capital plan to upgrade the Pacific-approved centres to meet evolving Mental Health Commission compliance requirements. The Executive is also developing a longer-term 10-year capital plan for mental health. This will help determine priorities for improving facilities nationally to underpin the implementation of models of care and the type of infrastructure envisaged under the National Mental Health Policy, which is sharing the vision. The new Mental Health 10-year Capital Development Programme will focus on upgrading existing facilities, replacing inappropriate facilities and the continued expansion of services. In the context of capital infrastructure development, Minister Butler has secured an additional $2.1 million to facilitate the opening of 18 beds in the National Forensic Mental Health Service in the Central Mental Health Hospital, Portrane. Opening these beds will increase capacity in the system for forensic mental health services, which is a priority for both the Departments of Health and Justice. The beds will also allow patients to move through the various levels to support offered by the forensic care pathway in the hospital, and in turn allow for further admissions across the Central Mental Health Hospital. I also look forward to the opening of an additional 20 CAMHS beds in the new Children's Hospital, which will support access to services in the state-of-the-art facility. It's meant to be a beautiful facility. I am sure you will all agree, CAMHS teams and those who work in our community and inpatient mental health services, along with the wide range of other mental health supports providers, by or on behalf of the HSE, make a crucial and real difference to the lives of those who seek mental health supports each year. I wish to acknowledge, both on my own behalf and the Minister for Mental Health, this work and their ongoing commitment to providing mental health interventions for the people of this country. The positive impact that increased investment, as detailed in today's opening statement, will bring to the child and youth mental health services will be tangible, measurable and impactful. Improving access to modern mental health services requires that the waiting list for CAMHS be addressed in order to continue to meet demand over 2025 and future years. CAMHS teams also need to be appropriately staffed. The investment I have announced for the 2025 will go some way to meeting the staffing need. Budget 2025 provides 95 new posts for youth mental health, including CAMHS, and I look forward to all posts being filled as a matter of urgency. Mental health supports come in a range of types of interventions, and it is important to note that the role of digital mental health services, as we seek to ensure that our services we provide are modern and make best use of innovation in our wider health service. A mental health literacy campaign was launched in October 2022. It is an ongoing and interactive campaign to create awareness and understanding of mental health. It enables people to recognise and manage their own mental health support, and by supporting health and others when identified a mental health need and identifying health difficulties at earliest opportunities, using self-help, social support and community services. YourMentalHealth.ie provides information and advice about mental health and well-being. This website has nearly 2.5 million views in 2024 with a 65% engagement rate. This is an important initiative source of information for people who may be seeking support and information. The .ie domain and the clear links to our National Health Service Executive ensures that the public can trust the information here, and in doing so can be signposted to a range of services. Most recently in the Health Service Executive Development and launched My Mental Health Plan, which has been in use since April 2024. This is an online and interactive tool designed to help individuals reflect on their mental health needs and receive personalised advice. The plan matches users' responses to questions to appropriate supports. This results in the user receiving tailored advice and resources. From April to December 2024, 13,600 individuals started their mental health plan through this website, with 13,100 of them completing their plan. This high completion rate speaks to people's satisfaction with the tool, and it provides important evidence, and this is a trusted and reliable support for people. In addition, Text About It is a free, anonymous 24/7 messaging service providing immediate support for mental health and well-being. Text About It provides a safe space where people are listened to by a trained volunteer. In 2024, there were more than 48,000 conversations on that platform, representing more than 4,000 conversations a month. Over the last year, the Department of Health, the HSE, spun out have been collaborating to commission and development of a dynamic web-based signposting tool. The Navigator app for young people aged between 16 and 34 years to support their mental health. The aim of this project, which has been developed thanks to funding secured by Minister Butler, is to facilitate help-seeking behaviours and enhance access to support. The app aims to provide young people, parents, caregivers and those working with young people with reliable, up-to-date information on where to access supports and services at both a local and national level for a variety of mental health issues. This tool is due to be launched before the summer. These examples show how over the last number of years Ireland has managed to develop and implement mental health policies that are very supportive of mental health promotion and recognises digital support as an important medium for mental health promotion. I can confirm that the officials of the Department of Health are currently working with the World Health Organization to develop the first digital mental health roadmap, which will draw on Ireland's experience in developing mental health digital supports and provide examples of best practice alongside other European examples. I look forward to the roadmap being finalised and published by the end of the year. In conclusion, it is clear from today's statements that mental health services in this country provide a wide range of supports from mental health promotion, prevention and early intervention, right the way to specialist inpatient services. The Department of Health continues to work with the HSE and partners in this sector to ensure that investment, innovation and improvements are made across the entire spectrum of services and in line with our national policies. It is important that everybody who needs help seeks help, and that we work hard to ensure that mental health is a stigma-free issue. Anyone can experience mental health challenges at any time during their lives, and that is why I want to repeat the vital message that often goes unsaid, that recovery is possible. If any person is feeling pressure, I encourage them to reach out for help. There are a wide range of high-quality mental health supports available in Ireland through the HSE or many agencies providing care on its behalf. The best way to find out what supports would suit someone is through their GP or via information signposting such as online youthmentalhealth.ie, which provides information and signposting on all mental health supports and services that are available nationally and locally, provided by the HSE and its funded partners. You have the free phone. Your mental health information line is available 24/7 to find supports and services. The number is 1-800 111 888. Text hello to 50808. The services provides emotional support 24 hours a day to anyone experiencing a crisis through engagement in a text message, conversation with a trained and supervised volunteer. On behalf of myself and Minister Butler, I thank you again, Ceann Comhairle, for the opportunity to discuss mental health in this stall today, and we all understand the priority and the urgency of this, and thank you again.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.